Let's talk about how to lower blood pressure naturally. Now, I'm going to give you some unconventional ideas, and I also assume that you've done the basic things that help reduce blood pressure. I don't like to repeat basic things like get enough sleep, exercise, etc. So I'm going to give you some unconventional ideas, but I can tell you these ideas work. I've done this now hundreds of thousands of times and hundreds of thousands of people, and this works in more than 90% of people to help reduce blood pressure and get rid of blood pressure medicines, even if you're on 2, 3, or 4 drugs. First of all, there are 3 principles, 3 factors we address. We reverse abnormal sodium retention. We then reverse abnormal insulin resistance. And lastly, we reverse abnormal endothelial dysfunction. Let's talk about each and every one of those factors. First, sodium retention. The problem with sodium retention is not sodium intake. That's what happens in conventional advice, right? They tell you to limit the sodium intake. That's not the problem. The problem is sodium retention. So what causes massive sodium retention? 2 things I'm aware of. The gliadin protein of wheat and related proteins of other grains, and higher levels of blood insulin. So how do we reverse those 2 things? Reversing the gliadin protein potential for causing sodium retention and high insulin levels. Well, don't consume foods that contain the gliadin protein. That's wheat and all other grains, such as rye, barley, oatmeal, oats, rice, triticale, and other sorghum, other grains. But wheat's the main culprit. So eat no wheat, and you no longer get exposed to the gliadin protein. When you do that, when you get rid of wheat and related grains, you also get rid of the amylopectin A carbohydrate that raises blood sugar and thereby insulin to very high levels. So when you go wheat and grain free, there's a reduction or elimination of the gliadin protein and a dramatic reduction in insulin levels. And that permits a rapid, we say diuresis, a rapid loss of fluid and salt. So much so that in the first week of doing this, you have to actually salt your food and even salt your water and hydrate more than usual. Some people have actually passed out when they fail to do that. So that is a huge first step in lowering blood pressure naturally. The loss of the gliadin protein's potential to retain sodium and water, and the drop in blood insulin levels that permit a diuresis. Next, we reverse insulin resistance. What causes insulin resistance? Well, a number of factors. Consuming wheat and grains and other carbohydrates, they raise blood sugar and thereby insulin. Lack of vitamin D, lack of omega-3 fatty acids, lack of magnesium, dysbiosis and other disruptions of bowel flora, thyroid dysfunction, and iodine deficiency. So we address each and every one of those factors. We get rid of wheat and grains. We supplement vitamin D to achieve a 25-hydroxy vitamin D blood level of 60 to 70 nanograms per milliliter, typically 5 or 6,000 units of gel cap form per day. We supplement 3,600 milligrams of EPA and DHA from fish oil only. We supplement 350 to 500 micrograms of iodine per day from kelp or potassium iodide drops and optimize thyroid function, whole nother conversation. We supplement magnesium to obtain around 500 milligrams of elemental magnesium per day. And then we take specific efforts to cultivate bowel flora, specifically a high-potency multi-species probiotic in the beginning, in the early few weeks, enthusiastic consumption of fermented foods, and plentiful prebiotic fibers, preferably around 20 grams per day of prebiotic fibers from foods like inulin, acacia fiber, legumes, root vegetables, etc. And we also, and many people have to address SIBO and SIFO, small intestinal bacterial and fungal overgrowth. That's a more complicated conversation, but you will find some of my videos talking about SIBO and SIFO. Just following those strategies, diet, and addressing factors that allow insulin resistance, vitamin D, magnesium deficiencies, etc., reverses insulin resistance in the majority, especially when coupled with wheat and grain elimination. And lastly, we address endothelial dysfunction. What does that mean? Well, the internal lining of vessels, of arteries and veins, is lined by something called an endothelium. It's a simple single-celled lining that controls the tone, how tight or loose an artery or vein is. And when you have high blood pressure, you have endothelial dysfunction. That is an abnormal constrictive tendency of your arteries in particular. How do you get rid of that? Get rid of insulin resistance, get rid of abnormal sodium retention, and correct the factors that cause those things, like vitamin D, a lack of omega-3 fatty acids, lack of magnesium, dysbiosis, the metabolic endotoxemia of SIBO and SIFO. So now that sounds like an awful lot, but I can tell you it's really not that difficult. This is all detailed in all my books, my Wheat Belly blog, my Undoctored blog. If you want the most recent and concise way to do this, I've rewritten my original Wheat Belly book. I call it the Revised and Expanded Edition of Wheat Belly. That's new and contains the entire program on how to do this in that one book. And it tells you how to rearrange your diet, be free of wheat and grains and limit other carbs, how to restore vitamin D, magnesium, iodine, optimize thyroid function, how to manage your omega-3 fatty acid intake, and how to go about rebuilding a healthy microbiome. So that's all contained in the Revised and Expanded Wheat Belly Edition. And this is how you lower blood pressure. You do not need prescription medication for the great majority of people. You absolutely do not. And by the way, once we're on this program, we no longer restrict sodium. And most people on this lifestyle enjoy blood pressures of 102, 108, over 70, something like that. Magnificently lower blood pressures.